Hello, my name is John Yang, and my presentation will be on hair loss. I will be focusing mainly on hair on the head. Hair is made up of a protein called keratin. Hair are developed from an organ called hair follicles. Once hair protrudes to the surface of the skin, they are considered dead and not alive anymore. According to the anatomy textbook, there are 5 million hairs on the human body, and 98% of them are on the general body surface, not the head. This is a diagram of the hair anatomy. On top we have the hair shaft. Below the hair shaft is the epidermis. Below the epidermis is the dermis, which contains the hair root, erector pili muscle, sebaceous gland, hair follicle wall, hair bulb, dermal blood vessel, papillae, arteries, and vein. Below the dermis is the subcutaneous layer, which has fat. Types of hair. There are 3 types of hair. Vellus hair are the fine peach fuzz type that are found all over the body surface. Intermediate hair are the hairs that are on the upper and lower limb. These type of hair are shown characteristic of both vellus and terminal hair. Terminal hair are hair that are more heavy and deeply impigmented, such as hair on our head, armpit, eyebrow, eyelashes, and etc. Functions of hair on our head. It protects our scalp against the UV light, cushions the head from minor head injuries, and provides insulation to the skull during cold weathers. Life cycle of hair. The 4 phases of hair growth cycles. Number 1 is active phase, 2 regression, 3 resting phase, 4 reactivation. In the activation phase, hair continuously grow for 2 to 5 years and can reach a length of anywhere between 18 to 30 inches if left uncut. In the regression phase, follicle becomes smaller and hair stops growing. It then transitions into phase 3, resting phase, in which the hair loses attachment to the follicle. Once it is in this phase, the hair is considered a club hair, which means it isn't active anymore. The 4th phase is the reactivation phase. This is when the hair follicle produces new hair that will push out the club hair as it grows towards the outside surface. Hair shedding versus hair loss. What is hair shedding? In a normal healthy adult, about 50 hairs are lost due to hair shedding. Hair shedding is a natural process and is replaced by new hair. Some examples of hair shedding are hair on the combs after combing your hair, hairs on your pillows after sleeping, hairs in the shower after washing with shampoo. What is hair loss? In hair loss, the hair has completely stopped growing. You will notice severe thinning, bald spots, patchiness, or clumps of hair falling out on the scalp of your head. There are some types of temporary hair loss that can regrow again if the cause of your hair loss is reversible. What are some causes of hair loss? Examples are hereditary, genetics, age, stress, chemotherapy, immune system deficiency, overstyling, lifestyle, and hormone imbalance. In hereditary genetics, if hair loss runs in your family, there is a high chance that you will get it too because it is in your genes. As we age, our hair gets thinner and finer. In a very stressful situation that causes physical or emotional shock, many people will experience temporary hair loss that lasts for several months. Some examples are postpartum, depressions from loss of your life, such as a death in a family, loss of job, divorce, etc., anxiety. For cancer patients that are getting chemotherapy treatment, the chemotherapy drugs are strong medications that actively attacks growing cancer cell, but unfortunately, it is also attacking the other rapidly growing cell such as hair follicle. Immune system deficiency such as alopecia causes clumps of hair to fall out of your head. You will see multiple bald spots throughout the head. The immune system mistakenly attacks the hair follicle, thinking that your hair follicles are foreign bodies. Excessive styling, such as drying hair, tying your hair too tight, using chemical product, blow drying, straightening hair, curling, pulling your hair can cause hair loss. If scars occurs, then hair loss can be permanent. Some lifestyle factors such as diet, severe weight loss or weight gain, nutrition deficiency, smoking, steroid use can attribute to hair loss. In some females, hormone imbalance such as PCOS can cause female pattern baldness because the body produces too much male hormone and not enough female hormones. Here are some pictures of hair loss. Male pattern baldness versus female pattern baldness. In male pattern baldness, the hair extends upward to the crown of the head and eventually recedes outward towards the back and the side. As you can see from the picture, the receding form an M-shaped hairline. In female pattern baldness, the hair recedes outward starting from the middle top of the head. Although the pattern of the hair loss is different between both men and women, they are both caused by the genetic disorder called androgenetic alopecia. Treatments. Is hair growth possible? Depending on the type of hair loss one is experiencing, hair regrowth is possible. In temporary hair loss due to stress and lifestyle factor, hair can regrow if those causes are corrected. But in the more severe cases of hair loss that cannot be corrected, then treatment comes to play. Types of treatment are oral medication, steroids injection, laser therapy, hair transplant, platelet-rich plasma, microneedling. Are there a cure for hair loss? The answer is no. Hair loss can only be treated but not cured. Alternative. If treatment fails or doesn't meet your expectation, then what are the alternatives you can seek out? Hair concealer, wigs, toupee, hat. Accepting and embracing hair loss. Pictures of famous people who has accepted and embraced their hair loss. close this presentation, I just want to say that if hair loss happen, it's just gonna happen, and you either treat it or embrace it. There's worst thing that can happen. You can go blind, you can go deaf, you can have cancer. Hair loss is a cosmetic issue, and this concludes my presentation.